The National Institute for Communicable Diseases says South Africa is slowly entering the fourth wave of infections, with 7 provinces having recorded a significant increase in COVID-19 cases.
South Africa is entering into the fourth wave with 7 provinces. This is the Eastern Cape, Gauteng, KwaZulu-Natal, Limpopo, Mpumalanga, Northwest and Western Cape, having sustained increases in COVID-19 cases. Taking measures to reduce the spread of infection, including getting a COVID-19 vaccine, the wearing of masks and wearing them correctly, ventilation, is the best way to slow the spread of infection.
For more on the alarming infection trends in Gauteng, I'm joined now by Health and Social Security Systems Specialist, Professor Alex van der Heever. Prof, good morning and thank you very much for your time and joining us here on the Newsfeed AM. With a 19% positivity rate now reported in Gauteng, would you say we are, in a sense, on a fourth wave already, or should we be waiting for that 30% past the previous reported cases?
I think the positivity rate is around about 27% now in Gauteng. It's actually very serious. But what we don't know yet is whether or not these infections are going to translate into severe illness. So there's a question as to whether or not both past infections plus the vaccinations have allowed us to kind of de-link severity of cases and death from the infection trends. So we don't really know yet, and we also don't know the impact of the variant on severity of illness or death as well. So a lot kind of awaits us, and we will only see that within the next 2 weeks.
Are we able to tell at this particular stage what the impact is on the health system as far as those who are hospitalized?
Not really, because we would expect to see a slight rise. How many of those actually translate into deaths is also an issue. So the overall number of deaths is still relatively low, but there's a big lag between the surge in infections and the sort of severe illness and death. So I'm certainly hoping that we don't see the hospital system becoming overwhelmed. But I think that the number of infections that we're seeing in Gauteng is very high. If that does translate into hospitalizations and death, it will be a real problem. We could see near doubling. If we see the trend, the number of infections in Gauteng could go to 11,000 today, based on the figures, if they continue with the current trend. That would be kind of worrying if that translates into inpatients.
Now, there are 2 factors at play here. Fine, we've got a very low vaccine penetration, but however, we've also had a number of South Africans having contracted the virus previously. Does that come into play here in as far as the immune that many have built towards the virus?
Yeah, it can play a role. There are questions around whether or not people who've developed immunity through infections have stronger protection relative to people who've been vaccinated. The indication is that vaccinations provide better protection, but having been infected will provide some protection, and a very large proportion of the population has been infected in all 3 waves to date. So it clearly will play a role. But the only question is whether the variant that we're seeing now escapes both previous infections as well as the vaccines because of the extent of the mutations. So I think that's where we're kind of, it's a big unknown at this point. But I'm hoping, and I think that most people are hoping, that in fact the immune responses from previous infections and from vaccinations will have an impact. But we will have to wait and see, and I think that contingency planning on the basis that we will still have very large numbers of inpatients and deaths arising due to the variant need to be in place, therefore. So I think we have to plan for the worst and hope for the best.
Let's talk about that contingency planning. We're expecting the Premier of Gauteng, David Makhura, to brief us later on this morning in as far as the provincial rollout of the vaccine programs. Is that going to be helpful at this particular point with already the fourth wave setting in?
Look, I think it will. I mean, everybody that gets vaccinated, it's going to make a difference. we're going to see this wave, it's going to be in existence through much of December. So if you get vaccinated today, after about 2 weeks, you're going to be getting a relatively strong immune response. So it will impact during this particular period when there's a high possibility of infection. So I think that nobody should hold back on getting vaccinated. It is certainly worthwhile. And a lot of the places that are providing vaccinations have very small queues, so it's possible to get through quite rapidly. It's not as if these are overcrowded settings. A lot of people can be vaccinated very, very rapidly now in South Africa, and people just have to make use of that opportunity.
Now, of course, we're already seeing numbers rise in other provinces as well, not as high as we're seeing here in Gauteng. Is restricting mobility at this stage something that should be considered? I mean, how do you expect in terms of modeling, the infections to go around as far as their numbers rising in other parts of the country?
We've seen that restrictions on mobility haven't had a very big impact on infection trends. I think now we're kind of going to experience what we're going to experience. So travel bans, mobility restrictions, etc., don't play a very big role in prevention. Our real major prevention intervention is the vaccination strategy, and that we really have to make full use of that. There aren't going to be many other options that face us. And to the extent that any restriction is put in place that harms the economy, we at this point in time can't really cope with the social implications of more people becoming unemployed and more businesses going out, becoming bankrupt. We already are going to be harmed by the irrational action of the UK, EU, and the US in the travel bans in South Africa, which have impacted on our tourist industry, which is a major industry in South Africa, and that's going to create a hardship that was completely unnecessary, and is very difficult for the country at this point in time to cope with. So we really have to minimize all economic implications of the pandemic and focus on the vaccinations as our key prevention strategy.
Prof. Alex van der Heever, very good morning to you. Thank you very much for joining us and your intervention this morning. There you are. The positivity rate now sitting at 27% there, according to the professor.